Welcome all to Meditrack program. Today we are discussing about the hair loss treatment, and in this session we have two doctors, Dr.Prajwal sir, plastic surgeon, Sashirekha Multi-Speciality Hospital, KANHANGAD, Dr.Faizan Kalekhan sir, a dermatologist, Sashirekha Multi-Speciality Hospital, KANHANGAD. So welcome sir both. Okay. See sir, suppose I'm asking that naturally we have a doubt about suppose we are losing hair. To whom we should consult the doctor, whether it is a plastic surgeon or a dermatologist. See, both you are here. So please explain that one first.
Yeah. Basically, that's a very good question. So everyone has this thing in their mind, whom to consult, whether a plastic surgeon or whether a dermatologist or whether anyone else. So generally, whenever someone has hair loss,
Okay.
So there is some underlying cause because of which this is happening.
Okay.
So most of the times, since everywhere we get free advices, so a lot of salon and beauty parlors, everyone gets advised that okay, they need to do this, that.
Okay.
But all those things which is advised by them is limited to the hair, which is outside, to take care of the hair cosmetically.
Okay.
So underlying disease aspect, whenever we want to tackle, a better person would be a dermatologist, because we have studied in our curriculum whatever is happening.
Yes.
And when the treatment aspects involves something which is a little more minimally invasive or a surgical aspect, that is when a plastic surgeon comes into the picture.
Okay.
But since nowadays both dermatologists and plastic surgeons are into the cosmetology field, so dermatologists and plastic surgeons both are the right people for hair consultations, and we are the right people to understand what is the underlying cause and how to tackle the hair loss.
See, basically, what is the cause of hair loss, sir?
See, the cause of hair loss generally can be divided into two big divisions. One is the genetic hair loss, the other one is a non-genetic hair loss.
Yes.
So the genetic hair loss is the one which is called as androgenetic alopecia, which is commonly known as baldness, which runs in family. Okay, this has, as I said, genetic hair loss. It has a genetic predisposition. Whereas the non-genetic hair loss is because of some factor inside the body which is causing the hair to fall. So these factors can be again divided into hormonal imbalances or stressful situation, whether it is physical, mental, or within the body, or environmental. So any of these causes, multitude of the causes can cause hair fall. So generally when we tell non-genetic causes, anything and everything under the sun can be the cause in environmental factors. So we have to first understand what is wrong with the particular patient, what is happening, and then understand the situation, and then further target the specific cause and give the hair loss treatment.
Prajwal sir, let us see the treatment procedure.
So most of the patients come with different grades of hair loss, starting from grade 1 to grade 7, complete baldness kind of thing. Based on the grade of the baldness, we suggest them the treatment options. And when you tell treatment options, there are multiple treatment options hair loss, but not all the options are giving 100%. No treatment is telling that no, it will cure the baldness. Baldness, we cannot cure it. We can give treatments to prevent the hair loss and also to cover the baldness with some treatment option. But there is no treatment as such to stop the hair loss because of genetic reasons. That treatment is not yet come into the picture. Now coming into briefing into the types of treatment what we have, the first treatment what we try is a medical management, which is mainly done by either with medicines. I think Dr. Faizan will be telling more about it.
Faizan sir, continue.
Generally for any sort of hair loss, the first line of management is medical management before going into the procedural or surgical management. So when we divide the treatment aspects, medical management, procedural management, and surgical management. Among the medical management, there are broadly 2 to 3 category of medications which is prominently available in the situation. One is called as a minoxidil. So many common man, it's very common, everyone has heard about this particular word called as minoxidil. So what happens with minoxidil is many wrong concepts also are there about minoxidil on internet, saying once we stop minoxidil everything will go. Correct, it will go. Reason is because hair loss is not a disease, hair loss is a condition. You are treating the hair loss with certain medication like minoxidil, the moment you stop that treatment, obviously the genetic factors will play the role and again continue whatever is happening before. So predominantly in medical management, there are certain growth factor serums other than minoxidil. There are other new molecules which mimic the action of minoxidil. So there are many things which are under research and which has come out proven successful. So we start off with that. So along with this topical application, we also supply something to the body in the format of growth factors tablets. So what it does is it provides nutrition, adequate nutrition to the internal system, and these nutrition will enter the blood circulation and reach the hair. So specifically for hair, there are somewhere about 20 to 25 minerals, vitamins and trace elements which are required. All that will be compacted within a tablet formulation and we give for certain time period. So with this medical management, for a certain time we see or notice how the improvement is there. If at all improvement is there, if a person needs something else, then in combination we have to further do other treatments.
See, what are the other treatment, Prajwal?
See, other treatment, the second option would be something, it's very revolutionary in our treatment here actually. It's called as platelet-rich plasma. It's called as PRP therapy. Where and it's also nowadays we also get something called as
PRP, that procedure. What is
PRP?
The procedure?
It's a basic simple procedure where we use their own blood. So blood, in the sense, we take a small sample of blood from the patient, maybe around 15 to 30 ml of blood, and once we get that blood, we process that blood actually to get the growth factor. Once we process the blood, we get a platelet derived growth factors. This, when we inject back into the scalp, so what happens that we are giving the scalp with the growth factors to help to grow the thin hairs.
During this process, sir, when we are when doctor is injecting the hair, that time will they get any injury? The patient will get any injury?
Not really. There's a very small pricks which we
will
are
they get
using.
any pain?
See, pain will, I'll tell you, we are pricking with the PRP.
Sufferable.
Not much, because see, when you are, for example, a diabetic patient is taking the insulin. So same insulin syringe we are using there. So basically, obviously, if we are able to take a medication through the insulin syringe, the same syringe we are using to give the PRP. So yes, definitely some discomfort might be there, but it's not very painful kind of thing. And while we injecting the PRP also, we also do something called as to distract the pain, we put a vibration. So in the different area. So what happens that the brain will not perceive that as a pain. So it will be more comfortable for the patient.
It's a temporary pain.
It's a temporary pain. And after the procedure, they needn't take rest or something like that. They can go back to work immediately after the procedure. It hardly takes around 1 to 2 hours into the clinic. Because once we draw the blood, we need some time to process the blood, and after that we can inject into the scalp.
So how many sessions needed, sir?
Usually we suggest, it is no rules that this many sessions has to be done to this some certain amount of patients, but what we usually follow is that minimum of 4 to 6 sessions a month apart. This is what we suggest, because the hair cycle will be around 6 months. So that is why we calculate accordingly to every 4 to 6, like every month at least 4 to 6 sessions. Following that, we can just once a year or twice a year we can just give a booster dose to just to improve the growth of the hairs. This can be done to the patients.
See, after 1 or 2 sessions, will they get a chance to getting back the hair?
See, usually that is very dependable, because see, PRP will definitely give you some results. But how much results, it depends on your growth factors also, because you are taking your own blood and that we are injecting there. So some people will have drastic results in 1 session only. Some people will get some results after 4 sessions. But definitely they will have results. But only plus point of PRP is that it doesn't have any side effects. It doesn't have, because it's your own body product. We are not injecting something else, commercial product, and we are injecting your own blood, own growth factor coming from your own blood actually. So we don't have any side effects there. So that is a big plus for the patients.
See, Faizan sir, after 4 session PRP, see, suppose the patient will not continue the next session. See, any chance of losing the hair?
See, basically everything has to be maintained with medical management as well. That is
suppose
why
that patient have a good result. Let us see. See what will happen.
So that is why we tell the importance of combination treatment. So PRP alone is like a booster dose to the hair in that particular hair cycle. So we are giving treatment for that particular hair cycle, and once the hair cycle is benefited, and the hair follicle is regenerated and growth is good, it has to be maintained with medical management. That is why the maintenance sessions, if it need not be monthly once, and it can be once in twice in a year or once in 3 months also. So it is, I always give an example of how it is equivalent to a fertilizer. For one farm, every day we keep putting water, but once in a while we put fertilizer so that the growth is good. If it is not put, still growth will be there, but you want good growth, you have to keep putting. So unless and until you don't want to lose hair and you have to maintain it, it is better to, when there is an option, minimally invasive, non-surgical option, it is better than going into a hair transplant. So always it is better to keep having maintenance sessions and also maintain it with medical management.
When you're doing PRP therapy or GFC also, GFC is a form of PRP only. It is commercially available. It's an activated PRP vital. Whenever you're doing this treatment, what we suggest to the patient that monotherapy, in the sense,
that means
only PRP means you will give some 60 to 70% results. But when you do in combination, you get around 10 to 15% extra. So what we do is we start with minoxidil, we do PRP, we do GFC, or sometimes we do something called as low light laser therapy also, all in combination, so that they get the better results. So that is what we emphasize on that. Usually we try with the combination therapy. And
see, Prajwal, nowadays, see actually who are the beneficiaries, whether it's male or female for PRP?
See, both will be having benefit, males and females, both will have.
Both the men and women have benefit with medical management as well as PRP therapy. So as I started, the root cause of the hair loss has to be noted. So the physiology of male body and the physiology of female body are entirely different. So whenever a person's cause for hair loss in a man is but predominantly genetic hair loss, whereas in females, though it will be a genetic hair loss, there are so many hormone influence. There are so many hormones influencing the female body, and because of the irregularities in the hormone levels, there will be hair loss. So we have to tackle that situation by giving oral medications as well as doing hair loss therapy. So all these things has to be targeted, and many of the times in ladies, generally vitamin deficiency is one of the major factors for hair loss. May it be vitamin D or may it be vitamin B12, which is measurable in blood. So these vitamins has to be corrected, and in case if there are thyroid abnormalities, that has to be corrected. So the root cause has to be tackled. So generally the regeneration of the hair follicle from outside can be done with these methods: medical management, PRP, growth factor therapy. So that way both men and women will be benefited definitely with PRP.
See, we are discussing about the types of treatments, sir. So see, after PRP, what is the next type of treatment?
See, after PRP, see, for some people, I have seen some people, they don't want to see the blood also. So PRP is very simple, but still they don't want to take the blood at all. So some people ask me, doctor, is there any option, but not surgery, but non-surgical, is there an option without drawing my blood, can you give some growth factors? There is an option like that. There is something called as growth factors, which is artificial growth factors, which can be directly injected into the scalp without taking your own blood. So some people they don't want to take their blood and then process and then inject, or sometimes the growth factor may not be very good in their body because their immunity may not be good. So such people, what we suggest, we give some this called as artificial growth factors, which can be given into the scalp to get the better results. These are all the majority of the non-surgical options. After finishing the non-surgical option, if the patient still has hair loss or already is in the baldness in that phase, then we will be thinking of something called as hair transplantation.
Hair transplantation, yes. Let us see, sir, what is the procedure, how it is working?
See, hair transplantation is a surgical procedure. It is done under local anesthesia. It is not under anesthesia, where the patient will come in the morning, but it takes a lot of time because each has to be transplanted from one side to other side, and so it takes an entire day. And its entire team will be there. I myself, Dr. Faizan, all and our technicians, all of them will work in a team to do the hair transplant. Basic idea of hair transplant is that there are two methods of hair transplant. One method, what we do is that we take the hair, one strip of skin from the back of the head, and we cut that each strip of skin into small hairs, and that we inject here. That is called as FUT. But problem with this method is that we get one small line of scar. We get one small hair. And now the newer method is something called as FUE method, where we have a machine where we can take the individual hair directly without making any big cuts. We just make a small hole and we take that hair individually, and each individual hairs are then transplanted to the received area.
See, if you are taking individual hair, if the area is more, sir, then how it work?
Basically, see, when you tell hair transplant, it is called as follicular unit we tell. See, follicular unit is that there will be some hair root.
Excuse me, you already mentioned that it is a long procedure.
It's a long
Suppose the area is vast or more.
Then we might do in 2 days.
Yeah.
We can do in 2 days because it is under local anesthesia.
Yeah.
There the patient will be, can see a movie, can eat some food, he can take a break, he can move around here and there.
Yes.
So this is a hair transplant is such a procedure there. So we can do as per the convenience of the doctor and the team. Either they can finish in 1 day or they can do in a second day also. And time, why it consumes so much time is because it needs a lot of precision, because the hair is so thin and we have to take that root in that proper size, and that hair root has to be placed in that proper size only. And second thing, it's not just placing the hair also. We have to place in an angle itself. See, otherwise if you place a hair like this, the hair will start growing like this, like a porcupine. So you have to place a hair in an angle so that you can comb the hairs very good. So that angulation you have to have a calculation. So only the expert in hair transplant we can do such a natural hair transplant results.
See any side effect for this procedure, sir?
Hair transplant is most commonly very safer, very safe procedure, unless done by a registered practitioner. I will tell you why, because most of the
we can see that
there are so many ads coming up.
Ads are there.
A lot of other specialties are doing who are not supposed to do. But problem is that the environment. See, you are doing. See, we do hair transplant in a operation theatre where it is a sterile environment. You don't follow the basic sterility when you're doing hair transplant. Why? Because just to reduce the cost. To reduce the cost, what they do is they do in small clinic where there is some table and chair and they do transplant there. Imagine you are making, imagine you are taking 3,000 hairs from here to here. Imagine you are making 3,000 holes in here and 3,000 holes here
also.
And then you're painting it. So 6,000 holes you're making, and you're making these holes in an environment which is not sterile. How it definitely can go for infection. So we have seen some complications in hair transplant when a non-practitioner has done, because they don't know how to maintain the sterility there. Otherwise, procedure itself doesn't have a side effect and results are very good. 90% results will be there. Why? Because this, see how much baldness you get, this hair will not lose. You will not lose this hair. So we are taking this hospital hair here so that it doesn't fall so easily. So results will be very good.
See, for instance, sir, after this procedure, that means hair transplantation, the patient, what they are following after that?
There are some strict instructions given to the patient. The first wash after the hair transplant will be done by the doctor. So the center where we have done the hair transplant, because the hair follicles which we have transplanted has to not get misplaced from their specific areas. So after the first wash, the patient has to take care of the transplanted hair very well for the next 3 to 4 months. As and when days passes by, the 3rd month, 4th month, 5th month, patient will start noticing, and some people will get scared and come back to us saying all the hair which is transplanted has gone. That is a natural phenomenon. Whatever we are transplanting is not an artificial hair, it is a natural hair. It has its own cycle. So the hair shaft has gone, but the follicle is inside itself. So as and when time progresses, 4th month, 5th month, 6th month, new hair again starts developing from there. So we wait for 2 hair cycles. So individual hair cycle, like sir said, 5 to 6 months if we consider. 2 hair cycles is around 10 to 12 months. So once 1 year is done, whatever response is there, the 3rd hair cycle which has started, that is considered as a result for hair transplant what is done. It is not what is there on the 3rd month or 5th month to 6 months.
We need to wait for 6 months to 1 year to get the results.
And meanwhile, during this process also, we do combination therapy with PRP. Pre-hair transplant, during the hair transplant, post-hair transplant.
Why? Giving like manure.
It is like giving manure and fertilizer to the hair so that it grows well. So that is how we maintain
can expect a very good result. Like
this pattern will definitely give a good result, and with very low side effects. But yes, if a patient who is a 25-year-old male who has a hair loss, active hair loss, if he comes, we will try to do medical management first. Why? Because we tell them as
medical management.
Why? Because that is called unstable hair loss. It was unstable because he is long way to go. If a patient comes at the age of 35 or 36, and we straight away tell hair transplant because they are in stable hair loss, because there is nothing more to lose. Because that is how it is. But yes, definitely we start with medical treatment.
After 50 or 55 means it is difficult.
You can do hair transplant. You can do hair transplant. Age is not a limit for hair transplant. Hair transplant can be done. Only thing is that if a patient has a grey hairs, then we can get only grey hairs, not the darker hair. And this hairs after transplantation, it will be like a normal hairs. You can comb, you can cut the hairs, and you can trim, and it can grow back. It's a natural thing.
Okay. See, Prajwal sir, suppose the patient has no back hair, then how to solve this one? From where, which body part they will take, you take this hair?
See, if there is no hairs on the back of the head, then you can take hairs from the beard area. You can take the body from the chest area, body hairs also. But having said that, taking the hairs from the face and the chest is little more difficult compared to the back of the head. And also result wise also, the hairs which we take from the back of is much superior. And is in the same quality of the present front hairs. But when you take the hairs from the facial hairs, it will not be same quality like that.
Then what will be the result?
Results will be not that great results, but definitely something is better than nothing. So usually when there is no hairs in the back, definitely we have to take from the face and the chest hairs.
Okay. Hair loss is not a problem. Here is two doctors, Dr. Faizan sir, Dr. Prajwal sir. If hair loss has any problem, you can approach the doctors. They are in Sashirekha Multi-Speciality Hospital, KANHANGAD. Okay, today we are winding up the program. Thank you sir. Thank you very much.
Thank you.